We know that cases were transmitted in the community, and there was an increased pressure of transmission in the Lower Mainland compared to the rest of the province. Part of that had to do with the population. That's a much higher population, the population density, but also our proximity to Washington State and the introductions of quite a lot of people, both people traveling back and forth and people from Washington who came to British Columbia. So the challenge that we had and the initial outbreak in the Lynn Valley Care Centre is representative of this, is that it was a very mild illness in many people, and so the outbreak was not detected at its early stage. It was well advanced by the time it was recognized, and it's unfortunate. I mean, it's really challenging for us. It was during influenza season where people are heightened awareness of respiratory outbreaks and influenza-like illness in those communities. But there were, in retrospect, quite a few people, both residents and staff, who were affected by the time it was recognized. And this just shows us how challenging it is to play catch-up with this virus when you don't detect an outbreak early. And we have that same example from Washington State, where they had a number of care home outbreaks as well. And as we know, there's nothing we have right now to prevent transmission or to prevent you from getting sick after you've been exposed. And we've come to recognize how challenging it is to manage these outbreaks, particularly with people having mild disease. So that's, that is unfortunately what happened both in Harrow Park and in Lynn Valley. I think we learned, though, across the province from what happened, particularly looking at Lynn Valley, and we've taken a number of measures in all long-term care around the province to ensure that we heighten our awareness, that we focus testing on those areas to be able to detect it early. We've put in measures around healthcare workers not transferring between different facilities as frequently, and that is something we're doing across the board as well. But all of those enhanced measures have led to very few cases in most of the other outbreaks that were detected very early, and is one of the reasons why here on Vancouver Island and in the rest of the province, all of the long-term care facility outbreaks we have are in Fraser Health or in Vancouver Coastal. So I think it's a testament to learning from the initial outbreaks, learning from what happened in Washington State, and trying to do the best we can to protect that very vulnerable population of our seniors and elders in long-term care.